Blankley, can you hear us?
I can hear you.
Wonderful.
Right. Got everybody? Okay. Legislator Bonnet?
Yes.
Okay. All right. The November 25th, 2025 meeting of the Human Services Committee will now come to order. The clerk, please call the roll.
Mr. Blankley.
Here.
Mr. Blankley is present. Ms. Bonnick.
Here.
Ms. Bonnick is present. Mr. Brew. Mr. Brew is present. Mr. Cruz.
Presente.
Mr. Cruz is present. Mr. Dondorfer. Mr. Dondorfer is present. Chairwoman Hasman.
Here.
Chairwoman Hasman is present. Mr. Milne.
Here.
Mr. Milne is present. Ms. Smith. Ms. Smith is present. Ms. Vasquez Simmons.
Here.
Ms. Vasquez Simmons is present.
Before we get too far into the evening, I'd like to take a moment of personal privilege to wish our majority leader, Michael Udison, a very happy birthday.
Yay!
Is there anyone signed up for the public forum?
Yes, there is. When I call your name, please come forward to the podium. You'll have 2 minutes in which to address the committee. Also, please do not bring up any signs or props. Do not single out any legislator individually, and please conclude when the buzzer sounds. Our first 2 speakers are Raul Wilcott and Amy D'Amico. Thank you.
Good evening. My name is Raul Willock. I'm the general manager at Motel 6. The reason why I'm here today is in regards to talking about a partnership with the county and but a lot of the changes and the great things that we're doing at Motel 6. I'm here today because the community is facing increasing housing challenges, especially as the temperature drops. We want to be a reliable partnership with the county, public safety, and holding ourselves accountable in regards to what our motel offers. When most people think of a motel, it's like, okay, it's a bad narrative, but we've changed the entire concept in regards to what Motel 6 has to offer. We understand the public safety and community stability and priorities that we have upheld. Our hotel has undergone significant amount of renovations. We're fully prepared to support the county's emergency and transitional housing efforts. We currently offer extensively clean rooms, well-managed property, not because I'm at the realm of it, but I believe in customer service, and we're in the business of hospitality. We can help the county reduce shelter overflow, provide safe, warm options during the cold months, and even extensive after that. In regards to where this partnership could not just be from the winter, but also for the upcoming seasons like the fall, spring, and so going forth. This is an opportunity for us to build a partnership. It is a commitment to support Monroe County's efforts to ensure no one is left without shelter. Our team takes great pride in being responsive and coming up with great solutions to be part of the solution, not the problem. That's pretty much what I have to say.
Hi, I'm Amy D'Amico. I'm from Rochester Grants Past Resistance. I'm here to talk about 3 items in the budget that have to do with this committee's work. The first is Project Anchor, which is something that helps a lot of families with rent when they're facing eviction. And I've known families across the county that have benefited greatly from Project Anchor. It's in the community, it's at several locations, and it seems to be running very well, and I wanted to report back on that. I also saw in the budget that there's a program called Project Prosper or Prosperity. It's a smaller program that I don't know if it has already started or is it about to start, but it's funded in the budget. And I'm concerned and hope you will take a closer look at it because it sounds like it's for only the deserving poor. Which is and blames people for their poverty and asks them to take financial classes in order to get some funding from the county. And just a project like that doesn't sound like it may be evidence-based. Finally, I'm concerned there's not enough funding in the budget for DHS staff, considering the administrative requirement changes under SNAP we know that able-bodied adults without children may not be eligible for food stamps anymore, starting now, but really in February. They're gonna lose SNAP for a year if they're not working. There's a lot of people who qualify for exemptions from these requirements, but there's not enough staff at DHS to help them get that exemption. And so right now they're asking community to step up and fill in the gap, and there's not enough of us. So I think if there were more funding for DHS staff, they would be able to help make sure that the SNAP benefits that people have earned or deserve, they can actually get. Thank you very much.
Thank you. Moving on, I would like to introduce Jennifer Cesario, Chief Financial Officer of Monroe County, who is here to present the 2026 proposed Monroe County budget as it pertains to the Human Services Committee. We will have a question and answer period following the presentation. Ms. Cesario?
Good evening. Find the next page. So budgeted spending for Health and Human Services accounts for 56% of the county budget, or $878.5 million. Appropriations for this segment of the budget appear to be growing by only $12.6 million. However, last year, DHS's budget included the $25 million anti-poverty grant, which is not included in this year's budget. So actual appropriations are increasing by $37.6 million. Looking at the Department of Human Services budget, I got ahead of myself. For 2026, we see increases in human services, public health, and MCH. Veteran services is remaining relatively flat. The proposed budget for DHS, of course, I just mentioned, shows a decrease of $900,000 on this slide. But as I just mentioned, last year we included that grant of $25 million. So absent that grant, the DHS budget is actually increasing $24 million. Appropriations for public health are also increasing $7.2 million. And again, like previous years, that is almost entirely related to early intervention and preschool special education services. Budgetary growth at MCH is $6.2 million, and that is mostly related to salaries and benefits. Thank you. The Department of Human Services. Within this department, again, social services looks like the decrease. I just mentioned that twice, so it's really increasing $24 million. Significant changes within human services. Salaries and benefits increased $10 million, including a 6% vacancy factor. 2026 proposed budgets, the full-time equivalent count is the same as the 2025's adopted budget. MMIS weekly shares increased by 1.9 million. That's our payment to the Medicaid cap. And so we are now budgeting the full Medicaid cap of $184.8 million. We haven't had to do that in the past. That has always been offset by the enhanced federal Medicaid assistance percentage. That has that is gone now. So we are budgeting the full cap. Public assistance benefits increase $11.5 million, and that's mostly related to daycare. Other expense is increasing $1.2 million. That is related to chargebacks that social services has to pay to the state for services they provide to us, such as the client notice system and the EBT cards. All those kinds of things are charged back to the county. Agency contracts decreased by $25 million. That is really related to the anti-poverty grant. Supplies and materials decreased by $143,000, largely a decrease of office equipment. We're increasing debt service by the amount $388,000, and that's related to the new Children's Detention Center. And we have an increase of interdepartmental services of 529,000. There's lots of stuff going on with interdepartmental charges. There's a decrease to the information services chargeback. But there's also increases in other things like the St. Paul building chargeback. Revenues also go up if you dismiss the loss of the $25 million federal revenue associated with the anti-poverty grant. Child care block grant revenue projection goes up 11.4 million. State aid for mental health services revenue goes up 1.6 million. Charges to other governments goes up 1 million. This is really related to the Committee on Special Education placements that are made by school districts, for which we bill school districts for half of the room and board, essentially. Turning to public health, appropriations increased by 7.2 million. Biggest factor attributing to this increase is $6.7 million increase to public assistance benefits in early intervention and preschool special education. Both rates and number of children participating in the program are increasing, as are transportation costs. Other notable changes in public health budget. Salary and benefits increased 713,000 with step and collective bargaining agreement increases. There are -3 full-time equivalents in the budget, and they also include a 6% vacancy factor. There's a reduction of debt service by $130,000 and an increase in interdepartmental charges, mostly related to an increase from information services of $644,000. Revenue increases in public health by $1.8 million. $1.1 million is related to state aid for EI/PSE services, and $652,000 increase to charges to the opioid trust fund for the impact team and the medical examiner's office. Moving on to Monroe Community Hospital. So this slide is different than the others. It's really related to their revenue and how we fund MCH. Patient revenues, all sources, Medicare, Medicaid, private insurance, represents an estimate based on the projected average daily resident census, our payer mix, and payment rates. For 2026, the budget is based on an average daily census of 415 residents, which is 5 more than the budgeted number for 2025. Rate assumptions included in the above number assume an increase of Medicaid reimbursement of 7.5%, as New York State is currently in the process of changing the reimbursement methodology to more closely align with the Medicare patient-driven payment model. Also increasing all private pay rates by 5% and establishing specialty private pay rates for the hospice unit. I can't say that. Hospice unit that opened in July 2025, and the planned secure dementia care unit that called Friendship Place. That's the planned opening is in mid-2026. The Medicaid upper payment limit revenue that is shown here of 19.8 million is really dependent on a negotiation between the state and federal government and is currently over a year behind. I am encouraged that we received a year of this revenue in 2025, but still concerned given the current political climate. Other revenues increased $1.8 million, mostly as a result of planned complex care revenue received by Monroe County to assist with hard-to-place patients. And I know that Bob Franklin, when he was in this role, said this to you, but I think it's worth pointing out again. MCH is an enterprise fund, and as such, it should be self-sufficient, right? Like any non-governmental business. As a result of the county legislatures and the county executives' support, we provide a tax subsidy to support the hospital, which helps offset really the low Medicaid rates that many residents in the hospital are subject to. And last but not least is Veteran Service Agency. There's not a lot going on with this budget. Appropriations increased by only $52,000, as there are slight increases in professional services and interdepartmental chargebacks from IS. And I just want to point out, I said it last night, but I'll point it out again tonight. There's 2 changes in every department's budget, and that's the way we budget for medical and dental. We used to budget them in commitment item 961,255 and 961,260 for medical and dental. Those are changed next year to 507,020 and 507,035. Just a way that we're going to account for those are going to be different under the new Workday program ERP system that we're implementing. So we decided to make the change in the budget. The other difference is information services. We changed the way we do, we changed the basis of our allocations to departments. So information services is in an internal service fund. It provides services to all county departments and charges back those departments for the services they provide. This year, we took a look at it as we were making this Workday transition and realized that we really needed to update the way we're doing that. So there's some bbig shifts in some of those lines that you'll see as we go through tonight, I'm sure. But I just want to point out that the way that we're doing it, we've decided to directly charge back for departments that need very specific software for their work, like a CAD program or something like that. That's being directly charged back from the information services. Anything else that comes on a typical laptop or PC is going to be charged out through, and all the rest of information services budget really is going to be charged out based on this, an admin and based on allocated by those number of devices and departments. So that's a big change from how we had done it in the past. It was very complicated and there was like 9 different lines that things could be charged to. There's only going to be 2 charges going forward. So hopefully it's made it simpler, but I know that there's some variances there and it looks kind of funky this year. With that, we'll take any questions you have.
Thank you, Mrs. Sario. Just as a reminder to the administration, as you answer questions, please state your name and title for the record. All right, and we will start with questions. Legislator Milne.
Thank you, Madam Chairwoman. Some general questions through you to the administration. And I know this was asked last night, I believe, in a couple of the departments, but what portion of Department of Human Services is mandated versus non-mandated efforts?
Through the chair, Jennifer Cesario, CFO. We can provide that to you.
Thank you. Continuing on to the administration, with the Children's Detention Center, what kind of impact has the new 58-bed addition made to the CDC? And along with the treatment and counseling of the detainees that they're getting, has there been any kind of positive impact on the amount of aggressive actions or that of the detainees that has been reported? Are we seeing any type of positive impact on having the 58 new beds?
So through you, Madam Chair, the facility is completed, training is taking place, but children have not been moved there yet. They're still working on all the protocols and making sure that people will be safe when they get moved there.
Thank you. Some performance questions through the chair to the administration. A major objective listed in the 2025 budget for Child and Family Services was to collect and assess data on interpersonal violence, but this does not appear in the 2025 major accomplishments of this budget. Why is it not listed as a major accomplishment in our 2026 budget?
Through the chair, the goal, I believe, is to determine if issuing an RFP for continued services was relevant to the county and the people we serve. What we have found is that we did not need to issue a RFP for this coming year first, because the service has been underutilized and the current ceiling has not been spent. So we did a no-cost extension of the contract through 2026. The challenge is that there have not been enough participants to collect data. The batterers for whom we would utilize the program have been less than enthusiastic about participating. I believe this year we've had 3 people complete the program, which obviously is not enough for whom to collect data. We have referred, I believe, 16. We are requesting, when we create dispositional plans through the court, and domestic violence is a factor in child welfare cases, that the court order participation. However, even with the order, we can't make the batterers actually attend.
Thank you. This may be a follow-up question for you too on another subject. I'm not sure, but through the chair to the administration. Also, a major objective listed in the 2025 budget for the Rochester Monroe County Youth Bureau was to introduce a new youth programs services locator, but it does not appear again in the 2025 major accomplishments. Was this locator created?
Through the chair, Denise Reed, Monroe County Department of Human Services. The locator was indeed created. You may have seen a press release regarding the yellow pages, reinvented as a new website. It is available on the Monroe County DHS webpage. Through the chair.
Thank you. Moving on. Thank you, Madam Chair. Through the chair to the administration. On page 173, the TANF and SNMOE all families work participation rate is projected to be 15% after projecting to be about 8% last year. Is there any type of explanation for this rise?
Through the chair, work participation continues to be a focus for the department during COVID, which seems weird to say because it's been 5 years, but we are still rebuilding our employment programming since it was suspended for about 2 years during the COVID era. So we're hoping to see increased numbers year over year of people participating as required by federal TANF and safety net regulations. Through the chair.
Thank you very much. And again, continuing on page 173, there were projected to be, through the chair, there were projected to be approximately 5,100 fair hearings in 2025 in last year's proposed budget, but the estimated number is now 8,700. Is this a similar response?
Through the chair, exactly. So again, during COVID, the New York State Office of Administrative Hearings drastically reduced the number of hearings and decisions that they performed, hearings that they performed and decisions that they rendered. Every year, we've been hoping that they would catch up. In 2025, they had a project where they tried to remove some of the pending hearings and settle them. And so hopefully that will catch them up, and we hope to see an increase in both hearings held and decisions rendered in the new year. Through the chair.
Thank you very much. And continuing on in the same venue, I believe, through the chair, there were projected to be 10,000 emergency housing placements in 2025 in last year's proposed budget, but the estimated number is now 1,000. That's quite a difference. Is there an explanation for that?
Through the chair, those performance measures are monthly.
Okay. Very good. Through the chair, to the administration, on page 178, there were projected to be 6,600 secure detention care days and 6,300 specialized secure detention care days in 2025 in last year's proposed budget. Now the numbers are estimated to be about 7,800 and 6,400 respectfully. Explanation for that?
I'm sorry, can you repeat the page and the first set of numbers from 2025?
Yes, I believe we have page 178. And it was projected to be 6,600 secure detention care days and 6,300 specialized secure detention days in 2025 in last year's proposed budget. And now the numbers are estimated to be 7,800 and 6,400.
Through the chair, yeah, that's a reflection of the new 58-bed facility that's being brought online.
Okay, thank you. And again, through the chair, the estimation for 2026 is now 10,985 secure detention care days and 99,015. Is this again solely for the new bed? And my question was, is this solely due to the construction of the new facility? And if so, where are the additional adolescent offenders coming from?
Through the chair, yes, it's a reflection of the 58-bed facility. Our facility will be regional facility, and so we will be housing youth from across the state.
Thank you very much. And my last question through the chair, on page 195, why is there such a large increase in OCFS eligible funds claimed? That was 194, yes.
Through the chair, that's a reflection of additional funding we received from New York State for sports funding.
Thank you very much. I yield the floor.
Any other questions? Legislator Brew?
Yes, good evening. My questions are pretty much all fiscal-based questions in nature. Through the chair to the administration, under appropriations on page 502, Human Services Central Administration, why are salaries increasing by $261K? That's page 502.
Through the chair, that's a reflection of the typical cost of living increase adjustments and collective bargaining agreement settlements and step increases.
Thank you. Through the chair, on the next page, 503, why is the FS law non-ICAP line item going up by $152,000?
Through the chair, that's really the same answer. The law department staff salaries increasing, so their chargeback will also.
Next question on 504, it may be the same answer. Why are salaries going up 1.4 million?
Through the chair, yes, that's same answer. This division has -1 full-time equivalent, but other than that, it's related to salary increases and benefits.
Okay, thank you. Why are same page? Why are commercial services going down by $200K?
Through the chair, the scanning of documents called buff cards, which holds historic information on clients related to cases, had been scanned through a contract. We determined that it would be less expensive to utilize a temp service to do the scanning and therefore decrease the cost of that contract and internalized the scanning project using temp workers.
Thank you. Through the chair, a similar question, why are professional services going down by 578K? Page 504.
Through the
At the same
chair, I
page,
mean,
Legislator Brew.
oh, sorry, that is related to a bunch, multitude of contracts. I can get you that list in writing.
Okay, through the chair, on page 505, Human Services, Child and Family Services, why is the IS Info Service admin going down by 144K?
Through the chair, that really is related to the change in the methodology to the from information services charged back to departments.
Okay, just a follow-up question on that. With the information services charged back, do the departments actually have a budget-related item that actually allocates anticipated IS charges for the year? Or are they on more of a pay-as-you-go, pay as the professional services are required to the chair?
Through the chair, the budget line that you just spoke about is the department's budget for information services chargebacks. Information services also has a budget in the budget book, but they have a huge negative number in that corresponding line that is like the chargeback. So you see the plus and the minus there.
Okay. And to the chair the administration. So this is the first year that the county has implemented this process for chargebacks to this common department that serves all of the departments.
Through the chair, we've had information services a very long time. We changed the methodology, the way we do the allocation. So, information services, a department has been charging back all the departments for as long as they've existed. It's just this year we changed the methodology and the basis for the allocation.
Okay, thank you. Through the chair, why is IS 691 St. Paul building going up by 130K?
Through the chair, that's really related to a DES chargeback. We spoke last night at Environment and Public Works. They are adding 5 positions and taking over the maintenance of St. Paul Street in the fourth quarter of 2026.
Okay, thank you. And through the chair, why is FS Law non-ICAP going up by 226K?
Through the chair, that really is related to salary and benefits and for law department staff.
Okay. I think I know I've heard this answer a number of times. I'm not going to ask that again. On page 506, why is temporary help increasing by 368K? To the chair.
Okay. Through the chair, we changed some positions to per diem examiners. And that is the reflection of changing that in the budget.
Gotcha. Through the chair, to the administration, why is the other expense line item increasing by 1.2 million and what falls under that?
Through the chair, that's related to New York's, the charges that New York State assesses to Monroe County for services they provide to social services. So stuff like the client notice system, EBT cards, and all that kind of stuff, employment verification. There's a multitude of chargebacks and that they have been steadily rising.
Okay, thank you. And to the chair, to administration, why is the agency contracts line item decreasing by 961K?
Is that the same page, Legislator Brew?
Yes, same page, 506.
Thank you.
Through the chair, the contract list I spoke about for the Child and Family Services, professional services, I think will address, these contracts will be on that same list. So I'll provide that to you in writing.
Okay. On page 507 through the chair. Why is IS Info Services? I'm not going to ask that. I know that already. Excuse me, through the chair, why is 691 St. Paul building increasing by 385K?
Yeah, through the chair, that's the same answer. I think we're taking over the maintenance in the fourth quarter next year.
13. Through the chair on page 510, Human Services and Staff Development. Why are professional services going down by 135K?
Through the chair, Denise Reed from DHS. We had in 2025 and in 2024 a contract for professional development that will not continue in the new year.
Okay,
Through the chair.
thank you. On page 512, why is overtime going down by 200K? That's page 512 through the chair.
Through the chair, I think the Department of Human Services has been successful in filling positions at the detention center. Therefore, there is not the necessity of overtime as there has been in the past.
Okay, that's good news. Thank you. Through the chair on page 517, Human Safety, Safety Net Assistance. Why is the public assistance benefits line decreasing by 852K?
Through the chair, the way the safety net budget is developed is based on caseload, the average cost per case per month, and then we arrive at the dollar figure. Currently, our caseload is the current safety net caseload is 3,607 families. The caseload that's projected in this budget is 3,955 at an average cost of $760 per month. So slightly reduced. The other item in here that is changing things, emergency assistance to adults is part of this. And that is going down based on recent actuals, $420,000.
Yeah. So if I'm understanding your math, so the decrease in the caseload actually, through the chair of the administration, the decrease of the caseloads actually make up the majority of the 852K decrease?
Through the chair. So 440, I'm trying to do the math in my head. $420,000 is related to emergency assistance to adults. The rest really, safety net is going down very slightly. I mean, it's basically flat when you consider we reduced the cost per case per month by $10 over the 2025 adopted, and we have increased the number of families by 5.
Okay. Thank you. On page 518, this is a big dollar amount. Why are the agency contracts decreasing by 24.8 million?
Through the chair, that really is related to the anti-poverty grant, that those dollars were appropriated within the 2025 budget. They still reside in a grant. We haven't spent them all. We're still working on that. But that was not part of this budget.
Okay, thank you. Through the chair on page 519, Human Services, why is MMIS weekly shares report going up by 1.9 million?
Through the chair. So this number that's in the budget is our actual statutory Medicaid cap. That is this, there's no longer an EF-MAP reduction that we've enjoyed for the since they instituted the cap. So we're next year going to pay the full cap amount.
Thank you. Through the chair on page 520, why is public assistance benefits line item going up by 11.2 million?
Through the chair, that is related to daycare subsidies, and that is related to the number of children, the cost per case per month that we're estimating, and the state allocation for the child care block grant.
Okay, thank you. Through the chair on page 522. I know the answer to that. I'm sorry. On page 523. I know the answer to that one too. On page, I'll get one right here. On page 527, why are agency contracts decreasing by 618K?
Through the chair, can you repeat the question, please?
Yes, on to the chair, to the administration on page 527, why are agency contracts decreasing by $618,000?
Through the chair, that was primarily related to Lifespan's elder abuse outreach and prevention program that used to go through our office. It is now going directly to Lifespan as a statewide program.
Thank you. And 529, I think I can answer my own question. Why is temporary help being eliminated? Because you've hired more permanent staff. Is that correct? To the chair. 529, why is temporary help being eliminated?
Through the chair, you're right. We added, we were actually able to fill a position.
Okay. On page 533, Human Services, why are agency contracts going up by $195,000?
Through the chair, again, this is related to additional resources from the state for youth sports, regarding flag football and Dottie girls golf.
Okay, thank you. Through the chair on page 534, why are professional services going down by $444K?
Through the chair, we'll get back to you on that.
Okay. To the chair on page 537, why are professional services going up by $500K?
Through the chair, that's related. These are criminal court ordered cases were ordered by New York State for these individuals that are not ready to stand trial. Yeah, actually, Dr. Aycock's going to answer this one. Sorry.
Thank you. Through the chair, Dr. Dr. April Akai, OMH Director. According to criminal procedure law, it is required that every state within New York State and actually nationally are required to pay for competency examinations as well as forensic hospitalizations, no matter how long a person is in the hospital. And so that's why you see an increase, because we're seeing more of an increase of people who are needing competency examinations, which is required by the criminal proceeding law.
Thank you. On page 538, why are agency contracts decreasing by 625K?
Through the chair, this year, Delphi Rise had an emergency that you all approved funding for open access, and because of the injunction, money was given to them by New York State OASIS, so they did not have to tap into these dollars.
Okay, thank you. Madam Chair, I yield the floor.
Thank you. Legislator Dondorfer?
Good evening. Thank you. Through the chair to the administration, I know you touched on the child care block grants and the foster care block grants in your presentation. I may have missed it, but why is preventative protection a 65% decrease?
Through the chair, could you give me a page number on that?
I'm sorry, page 662, social services. I'll get better with that as we go along. Sorry.
Through the chair, this is really a reimbursement of what we're projecting to spend on preventive services. So we get 62% reimbursement for preventive, protective types of activities. So this is our estimate of what the 62%, how much we're going to spend next year.
Thank you. Through the chair on page 663, Child and Family Services, why is state aid for Child and Family Services decreasing by 234,000?
Through the chair, the way that DHS's administrative claim works is kind of complicated. It's really based on a random moment study that the state does, asking caseworkers exactly what kind of case they're working on and looking at that case to see what kind of eligibility it falls under. So there's fluctuations there. And as we prepare the budget, we take all the claims through the year and determine the percentages for each type of funding. So there's going to be fluctuations each year with a lot of this. Anything in Child and Family Services, it gets really complicated quickly, but based on the total dollars, that's probably not a significant decrease. It's just changing where we're actually able to claim the dollars.
So going on to, through the chair to the administration on page 664, financial assistance, federal aid and state aid is increasing by $1.4 million. Is that based on caseload as well?
Through the chair, so for the TA side of the house, they have a similar situation, but in addition, salary and benefits are going up. So therefore, we expect to get additional revenue.
Okay. Thank you. Through the chair, to the administration on page 666, safety net assistance. I'm assuming, is it same answer for the refugee and entrance going down 245K and safety net assistance going down 125,000? Is that based again on cases?
Through the chair, yes, you're correct.
Okay. Jumping forward through the chair to the administration, page 671, purchases of services. Why are gifts and donations going up to $661,000? Can you explain what that is and why it's going up so much?
Through the chair, we included COP set-aside contracts in this budget. COP set-aside contracts are no local dollars involved. They're 50% funded by a donation and 50% from the state.
Through the chair to the administration on page 679. Mental health administration, why is OASIS decreasing 338,000?
Through the chair, this is a reflection of the COLAs, and we're expecting that this will also be amended again.
Through the chair to the administration, just a point of clarification. Did you say COLA, cost of living increase?
Through the chair, Brendan Fleming, Chief Deputy County Attorney. Yes, legislator, through the chair. The 2025 amended OASIS line shows 6.6 million. The 2026 budget request is the 6.2, almost 6.3. Every year, state OASIS adjusts its state aid dollars that come to the county through the Office of Mental Health local governmental unit. And that doesn't happen until after the state budget. So we do expect that there will be an adjustment as the 2025 was amended up similarly.
Understood. Thank you. So then through the chair to the administration, continuing on 679, why is there the Office of Mental Health increasing by 1.5 million?
Through the chair, state aid dollars.
Just to further clarify that reflects an increase from the outset in state OMH, state aid dollars, additional pass-through dollars for contracts that local OMH will contract with community providers.
Okay. Thank you. Through the chair to the administration on page 681, opioid and addiction services, why is state aid decreasing by 625,000?
Through the chair, it's the same answer I provided regarding Delphi Rise in the emergency opiate dollars that you all approved.
Okay, thank you for that. Through the chair to the administration, moving on to pages 729 and 730, I just have some staffing questions for you. Why was another casework supervisor position added?
Through the chair, we are in 2026 going to be reconstituting a new team. So we had a request to add this casework supervisor so that we can do that. And that was approved in this budget, or will be hopefully approved in this budget through the chair.
If you don't mind, through the chair, I'm just going to rapid fire a few questions. You may have the same answer for all of them, if that's the case. And if not, I'll go through them one by one. Why are there 2 less senior caseworker positions? Why is there another supervising examiner position? Why is there 1 less caseworker position? Why was another senior examiner position added? And why were 4 examiner positions added, which I think you just answered? And then why were there 4 community outreach specialist positions eliminated? I'm gonna.
That was rapid fire.
Yeah.
Through the chair, we'll try to keep up. So
Well, I could go one by one if you want.
Well-
I just wasn't sure if any of those were connected to.
they are connected. So the two senior caseworker positions were abolished to create the new casework supervisor position for the supervising examiner, senior examiner, and new examiners. That is also going to be constitution of a new Medicaid team under the Financial Assistance Division. And
Why were there four community outreach specialist positions eliminated?
through the chair, another kind of swapping, abolish and create were those positions for community outreach specialists. You'll see further down, there's also abolish and create for community outreach specialist to a senior community outreach specialist. So just some internal adjustments for staffing to try to meet the needs of the department next year. Through the chair.
Thank you. And through the chair, why were two principal office account clerk positions added? And then in following up with that one, why are there two less office clerk 3 positions? Was it just another swap in the?
So those positions are actually accounting positions in our child support enforcement unit. And the lesser position is very, very difficult to fill because of the salary. And so we have increased the title commensurate with the work there, but also to allow us a better opportunity to recruit staff for those positions to do that work that's vital in the child support unit. Through the chair.
Great, thank you. And through the chair to the administration, why were 3 caseworker aide positions added?
Those actually casework aides, and this has been something that we've been doing in the department for a couple of years now, swapping out OC3, office clerk 3s, which are very difficult again to hire for case aide positions, which are not tested. Although we did recently receive help approval for OC3. Previously, it was a tested position and very difficult to hire. And so we have been swapping those out for case aides that provide support to teams in both Child and Family Services and the Financial Assistance Division. Through the chair.
Thank you. I yield the floor.
Legislator Smith?
Thank you, Chairwoman Hasman. I'm going to be going over some questions around the Monroe County Hospital. Yes.
Any other questions over here on the Human Services budget before we go to Monroe Community Hospital? All right. There we go.
Sure. Okay.
Don't want to have people jumping around too much.
I understand. So good evening. First, I want to say that I have nothing but been impressed with Monroe County Hospital and the way the hospital runs. Sitting on the advisory board, actually with Chairwoman Hasman, I think she can contest to it as well, that we're just amazed at every advisory board meeting, hearing of all the great things that you're doing for the residents of Monroe County. So some of the questions I have, I may know the answer to, but others may not. And I want to make sure that people understand the great work that you do at Monroe County Hospital. So I appreciate the spending some time and going over, some of these programs that you run within the hospital. So the first one, through the chair to the administration, on page 214, recreation therapy and wound care were added under specialty services. What do these services provide?
Through the chair, Desmond Jackson, Deputy Director for Monroe County Hospital. These activities involve such outings for the residents to get them back out in the community, as well as bringing other services into them, to the facility to enhance their life at Monroe County Hospital.
Thank you. And through the chair on page 216, under 2025 major accomplishments, it is noted that the Simulation Center received an Innovation of the Year award. What is the Simulation Center and how does it plan to expand? what more is needed for the center?
Through the chair, the Simulation Center is a unique center for Monroe County Hospital that allows us to enhance our education and training for our staff members, as well as other community partners allied with Monroe County Hospital. For future plans, we plan to extend that to again enhance further education throughout nursing, as well as other operations within the facility and partner within the community.
Great, thank you. And for my legislators, I'm sure Chairwoman Hasman thinks too. If anybody hasn't seen the simulation center, it's amazing, and I suggest that everyone get there to check it out. Through the chair, on page 217, under 2026 major objectives, the completion of the Friendship Place is listed as a goal. What is the Friendship Place? Could you tell us more about it?
Through the chair, the Friendship Place is a specialty unit within the facility for those residents who suffer with dementia. And our goal is to provide them with a better quality of life by providing them with more independent or more space that allows them to live with specialty rooms or private rooms and private space, and allowing them to really roam within their area of the hospital and not run the risk of getting out or being locked down. To the chair.
Thank you. Through the chair, could you clarify what specific advocacy measures to promote industry viability are planned as referenced in the 2026 major objectives on page 217?
Right here. Okay. Through the chair, Monroe Community Hospital is continually looking at ways to remain cutting edge and bring a better quality of life to its residents by securing grants and other means of supporting our residents and staff in the facility. We've also done things such as participate in the Leading Age New York that helps us to advocate for better care and better laws for skilled nursing, as well as helping particular residents work to leverage or lobby with the state to increase our resident allowance on a monthly basis.
Great, thank you. And through the chair to the administration, on to page 553, why is temporary help increasing by 430,000?
Through the chair, temporary help is increasing simply due to the fact that we are continually running into situations where hiring full-time staff becomes more of a challenge, and we have to rely more on per diem and per diem staff to fill in.
Thank you. Staying on page 553, why is the shift differential dropping by 90,000?
Through the chair, we're finding again full-time staff has been reduced as people are finding other means or other ways of supporting their households and picking up shifts on areas in the hospital is less attractive.
Thank you. And through the chair, I see on page 553, the equipment that was running in 2025 decreased in 2026 by 136,000. Is this one piece of equipment or was it multiple pieces of equipment?
Through the chair, again, this is one of the efforts at Monroe Community Hospital I spoke of earlier as far as securing grant dollars. We were able to utilize grant dollars to purchase specialty beds on the behalf of the hospital and pay for them that way.
Great, thank you. And through the chair to the administration. Why is medical affiliation contracts increasing by 141,000?
Through the chair, that is the affiliation agreement with URMC, new contract. The rates have gone up.
Thank you. And through the chair, I also see professional services increased by 140,000.
Through the chair, the professional services rate has increased due to the reliance on temp agency, temp staffing to fill the roles within the hospital.
Thank you. And through the chair, going to page 554, I see the medical and lab supplies increased by 344,000.
Yes, once again, through the chair, these are costs that continually increase over the year, as well as with the different levels of acuity of staff we take in, residents we take in, require additional services.
Thank you. Through the chair, on page 689, why was there an increase of 1.7 million in miscellaneous revenue? I'm not sure if you covered that earlier.
Through the chair, that's really related to the complex care grant that we expect next year.
Thank you. I have a few questions in reference to personnel. So this will be page 733 and 734 through the chair. Why is there no longer a collection and billing coordinator position?
Through the chair, we were able to abolish that position and create a medical billing position. And that will be totally for private pay, as was the collection and billing coordinator. It was easier to recruit.
Perfect. Thank you. Why is there now a unit administrator position employing 5?
Through the chair, the unit administrator position was a position we deemed necessary to help increase the quality of care within the facility. It helps to partner with nurse managers to ensure the overall care of residents and satisfaction of the families.
Thank you. And through the chair, I'm just wondering if these are connected somehow. There's no longer an assistant nurse manager position, resulting in the loss of 7 employees.
Through the chair, that is correct. We found we were able to abolish those positions as assistant nurse managers as we were experiencing difficulty in recruiting such staff in the facility, and found it advantageous to use those to create the unit administrator's positions.
Thank you. I also noticed the respiratory care practitioner through the chair, that 3 of those are no longer needed. Will this have any impact on our residents?
I'm sorry, could you repeat that page?
Sure, not a problem.
The page?
I don't have the exact page, but it's either 733 or 734. It's the respiratory care practitioner. I think we had 11 last year and we're going to 8 this year.
Through the chair, unfortunately, due to the challenge of filling such positions and running vacant for so long, we found that we could reduce the number of those positions and rely more on our RNs and existing agency RTs for that.
Thank you. Why is there a decrease through the chair? Why is there a decrease in positions from 2 to 1 for the cardiopulmonary technician in 2026?
Again, through the chair, due to the challenge of inquiring or recruiting positions, we've had to rely more on the cardio manager and assistant manager to fill what's fit, satisfy the needs.
Thank you. Why is, through the chair to the administration, why is there an added personnel analysis position from 1 to 2 in 2026?
Through the chair, this is a useful position within the facility that allows us to analyze our data and finances and create much needed dashboards within the facility to help us manage all of the needs of the residents and basically increase our overall care within the facility.
Thank you. And through the chair, overall, there looks like to be a cut of 7.5 full-time employees. What is the impact to the hospital with cuts and realignments?
To the chair, the impact of reduced headcount or FTE 7.5 primarily has been absorbed through shifting of other positions in the facility, allowing us to be creative with the resources and the staff we have. If we have found that certain positions that are necessary and needed, we would then pivot and try to create such positions in 2026.
Thank you. That's all I have for Monroe County Hospital. I was going to go to public health, but I don't know if you want to check to see if anybody has anything for Monroe County.
I have a question for Monroe Community Hospital, as long as we have staff out here. Yeah, I share my deep respect and just absolutely adore the work that you do at Monroe Community Hospital. So I want to share in those thoughts. Along those lines, under 2026 major objectives, you have maintained the average pediatric census greater than 90%. I was wondering if you could expand on what the kind of work that you do for the pediatric population and possibly how that's unique in the county.
Through the chair, Monroe Community Hospital work with the pediatrics is quite unique, as we are one of the only in the area providing such care for peds on ventilators and help is needed for community as far as taking in that population.
Thank you. Any other questions on Monroe Community Hospital? Okay. Legislator Smith, you had some more questions?
I do. Thank you. I have some questions on the public health. Through the chair to the administration, what percentage of the Department of Health budget is mandated and non-mandated?
Through the chair, I'll provide that to you with all the others.
Perfect. Thank you. Through the chair to the administration, are the fees listed in the public health department portion of the budget similar to other counties' fees?
Through the chair, Dr. Maria Elena Velez, Commissioner of the Monroe County Department of Public Health. Fees for specific tests and medical services certainly are comparable to other counties in that we, for example, in our immunization programs, receive vaccines through the similar programs. So some of those fees would be comparable across the state of New York. Other fees, for example, permitting of specific restaurants or other fees in that sense are typically about average. We have not done an extensive analysis comparing our fees to other counties. We are one of the larger counties in the Finger Lakes region, so it would be challenging to account for the difference in size to make an accurate comparison in every one of our divisions.
Thank you. Through the chair to the administration, on page 279 and 280, where are the fees for the autopsies going down, but the toxicology tests are going up?
Through the chair, which fees?
Oh, sure.
specifically, please?
Through the chair to the administration, it was on page 284. Oh, so sorry. That's my next question. It was page 279 and 280. The fees for the autopsies are going down and the toxicology tests going up.
Hey, good evening through the chair, Bob Zerby from the Medical Examiner's Office. So as it relates to fees for autopsies, these are the fees that we assess to outside counties through the chair for the performance of the autopsies contractually. The regular fees, the former fees, the bigger numbers you see were when we included toxicology services into services provided. Several years ago, we switched to NMS labs for the entirety of all the county work as well as our contract work. Currently, we've slid back to having our lab handle Monroe County cases, but we're still utilizing NMS for the other counties. So this recognizes the difference of the fee that we're not charging to the individual counties. It just kind of takes it off the table. Prior budgets listed this, but there was language written in the kind of in the text of the budget that said just subtract a certain amount for it, but it was just easier to put the numbers rawly on the paper. Through the chair.
Perfect. Thank you. Through the chair to the administration, moving on to page 284. Why have non-community water supply inspections and sampling fees more than doubled since 2024?
Through the chair, lab costs for a number of those tests have increased, and so we are passing that increase in cost on to those that require this testing.
Thank you. And through the chair to the administration on page 267, a major accomplishment in 2025 for early childhood development was conducting 7 outreach activities to underserved communities. Could you explain a little bit about what you did and what underserved communities these events were held in?
Through the chair, these are events where our teams are tabling frequently in the city of Rochester at such community events as the TIPS festivals, other events where we are informing typically low-income communities of the services that are available if they suspect or have a documented delay in any of their children age birth to 5.
Thank you. And through the chair to the administration on page 268, a major objective for 2026 for administration and special services is to collaborate with Lollipop Farm to provide pet boarding for Monroe County residents seeking to go to inpatient treatment / detox treatment. Could you elaborate on this program?
Through the chair, this initiative was an effort to contract with Lollipop Farms to provide boarding services for individuals who qualify for treatment, who are at a point in their lives where they're ready to enter treatment to get on the pathway for a stable recovery, and whose major barrier would be that sometimes their only remaining social connection is an animal that they no longer have friends or family willing to take care of. Our team has encountered this obstacle in a number of instances in their outreach. And so that contract has been signed and enacted, and we are happy that we will be able to use opioid settlement dollars to pay for this service that will free individuals to go confidently into their treatment, knowing that they'll be able to come back and their pet will be safe.
Great, thank you. I am happy through the chair to the administration to hear that we're using the opioid funds for this program, which I think would be great. Through the chair to the administration on page 282, the proposed 2025 budget estimated 800 examinations this year, but this proposed budget now estimates 920 for 2025. Could you explain the drastic increase? So it looks like we went from 800 to 920.
Through the chair, could you repeat the question?
Yes, on page 282, the proposed 2025 budget estimated 800 examinations this year, but this proposed budget now estimates 920 for 2025. Could you explain the drastic increase?
Through the chair, just to clarify, the 884 cases from 2024 actual compared to the estimated?
No, it looks like they were proposed. Proposed 800 in 2025.
Oh, okay. Through the chair, we are just seeing an increase in the number of cases that meet criteria for an examination by the medical examiner's office.
Thank you. Through the chair on page 539, Public Health Administration and Special Services. Why is temporary help being eliminated?
Through the chair, the salaries for this temporary help was shifted into the regular salary budget line.
Thank you. And staying on the same page through the chair to the administration, why are commercial services going down by 286,000?
Through the chair, some of these costs were moved to a grant.
Thank you. And staying on the same page through the chair to the administration, we see professional services going up about 166,000.
Services. Expenses.
Through the chair, a number of those costs have been moved to different general ledger lines.
Thank you. And the last one on that page of 539, I noticed the public notices were being eliminated. Did they get moved somewhere else?
Yes, through the chair. Yes, those costs were shifted to a different general ledger line.
Through the chair to the administration on page 541, Public Health Nursing Services. Why were professional services going down 113K? And we also see agency contracts going down 148,000.
Through the chair, the agency contract cost is related to our tuberculosis and STD clinics. They reduced their contract with Rochester Regional Health for laboratory services. And could you repeat the other part of the question?
Sure. Professional services went down 113,000.
Through the chair, there was a reduction in our contracting with a mobile X-ray service through our tuberculosis clinic.
Thank you. Moving on to page 543, Public Health, Maternal and Child Health Services. I also see the agency contract line items going away.
Through the chair, those costs were shifted to grants.
Great. Thank you. Moving on to page 545, through the chair to the administration, Public Health Medical Examiner. I see the maintenance equipment has gone up by 100,000.
Through the chair, there are expensive machines in that office. These are just tracking costs.
Thank you.
And there was, sorry, through the chair, there was some grants ended that previously covered those costs. So that was moved to county funds.
Thank you. And through the chair to the administration, I see agency contracts line went away here as well.
Through the chair, that is the toxicology lab taking back over some of the testing in-house as opposed to sending it out to the NMS contracted agency.
Perfect. Thank you for explaining that. Through the chair to the administration on page 549, Public Health, Early Childhood Development. Public assistant benefits are going up by 7 million.
Through the chair, this is related to all early intervention and preschool special education services are increasing, transportation costs are increasing, the rates are increasing for the providers.
Thank you. Through the chair to the administration on page 682, Public Health Administration and Special Services. Why are charges to the trust funds going up by 651,000?
Through the chair, those are costs associated with increased excellent work by the addiction services team.
Thank you. Going on to page 683 through the chair to the administration, Public Health Nursing Services. Why is PH Article 6 going down 128,000?
Through the chair. General ledger line, the revenues decrease when some of the Article 6 reimbursable expenses are also reduced. So as we do fewer of those services, we get less reimbursement from the state. Through the chair.
Thank you. Through the chair on page 687, Public Health Early Childhood Development. Why is ECDP admin reimbursement going up by 292,000?
Through the chair, this is actually the opposite of my previous answer, whereas there are increased costs incurred through this program, we are given increased reimbursement through the state or from the state.
Great.
Through the chair.
Thank you. Staying on the exact same page through the chair to the administration, I see EDUC handicapped child going up by 1.4 million.
Through the chair, this is a similar answer. All of that reimbursement is tethered to the amount of services provided that meet the state's eligibility.
Thank you. Through the chair to the administration, going to page 739, Have the associate medical examiner positions all been filled yet? If not, is there a plan to do so?
Through the chair, all of the associate medical examiner positions have not been filled.
Through the chair to the administration, do we have a timeline?
Through the chair, we are certainly actively recruiting through different locations of postings. Part of the collaboration that our department has had for a number of years with the University of Rochester's pathology department to do some of that forensic training in our department is a workforce recruitment effort. So there are multiple strategies being employed at the moment. The United States is not graduating sufficient forensic pathologists to meet all of the open positions that exist.
Thank you for the explanation. Through the chair to the administration, I see a senior medical investigator positions being added. Could you explain what that position will entail?
Through the chair, this is a senior medical investigator who is specifically overseeing the autopsy technicians, assisting the forensic pathologists in completing those autopsy examinations. Through the chair.
Thank you. And through the chair to the administration, I see we also are adding a community health worker position. Could you explain what that position will be doing as well?
Through the chair in the medical examiner's office?
I believe so. Page 739. Yeah, that's. They need to look like you're good. Community health worker.
Through the chair, that community health worker title is being used to fill previously difficult to fill positions in a number of programs. So this could be referring to one in our WIC program or in our nursing services division. Through the chair.
Thank you. I appreciate that. I yield the floor.
Thank you. Any questions on public health? Yes, sorry. Legislator Jessica Simmons.
Thank you, Madam Chair. And I'd like to thank my colleagues for asking all those excellent questions. I think it knocked down my questions by 2/3. So thank you. Through you to the administration, under Veteran Service Agency, page 344. Could you please help us understand the decrease in personal services? Personnel services.
Madam Chair, Nick Stefanovich, Director of Veteran Service Agency. The decrease in personnel services was due to us revamping the ecotherapy program and restructuring it in order to make it more efficient for the veterans out at the Equi Center.
Okay. Through the chair to the administration, could you tell us how many satellite offices we have in Monroe County?
Yes, through the chair, 2 satellite offices, one in Greece and one in Penfield.
Through you to the administration, how many FTs and PTs do we have at each location?
Through the administration,
The Veteran Service Agency at each location has 2 FTEs.
I'm sorry, can you repeat that?
Yes, through the chair, at location, the Veteran Service Agency has 2 FTEs.
Thank you. Through you to the administration, covering safety net assistance. Perhaps I didn't understand the explanation as to the decrease of $852,000. Could you please explain that to me again? To us again?
Through the chair. So there's 2 programs that are covered by the appropriations and safety net assistance, emergency assistance to adults and safety net. Emergency assistance to adults is going down $420,000. And that's really related to what we're actually seeing as providing over the last few years. The other appropriation, which is a much larger appropriation for safety net services, is the caseload that we're projecting for next year is 3,955 cases at $760 per case per month. So that math equals $36,065,149, which is slightly lower than the 2025 adopted budget by like $430,000.
Okay.
Yeah, we're currently, our safety net caseload, the current caseload is 3,607 cases.
Okay, through you to the administration, did we factor in any fallout from the recertification of the SNAP that potentially individuals may want to look at this budget, this program?
Through the chair, Denise Reed from DHS. So safety net appropriations actually don't cover anything with SNAP at this time. So the SNAP ABOD recertification or certification impending changes won't be reflected here. Through the chair.
Through the chair, do we know how many individuals or families will be affected by this decrease in safety net assistance?
Through the chair, can you repeat the question?
Do we know how many individuals or families are going to be impacted by this decrease in funding and assistance?
So through the chair, just to clarify, so the 2025 adopted budget is currently exceeds the caseload for 2025. So our spending is not on track to reach that. So in reality, the 2026 appropriations are not a decrease from what we're currently spending, even though in the adopted budget, it appears that way. So this actually represents an increase in safety net cases based on what we currently have active at this time, because we are under the 2025 adopted budget by several hundred cases and millions of dollars at this point. Through the chair.
An unfortunate situation. Through you to the administration, can you explain what state aid EAA is?
Through the chair, can you please repeat that question?
Through you to the administration, can you explain what is state aid EAA?
EAA, through the chair, stands for Emergency Aid to Adults. It is the category of assistance that is available to individuals that are in receipt of Social Security, Supplemental Security Income, SSI, through the chair.
Right. Through you to the administration, under family assistance, could you explain the decrease in salaries?
Through the chair, those salaries were actually related to the grant funding that we spoke about that's not included in the 2026 adopted budget, but was in the 2025 budget.
Right. Through you to the administration, why has under family assistance, page 667, the federal aid decreased by well over 24 million. Why has this age decreased by such a drastic number, and how will this federal cut impact Monroe County?
Through the chair, there is no impact to the county. That is related to the $25 million anti-poverty grant that was included in the 2025 adopted budget. It's not included in here. We still have the dollars. They're in the grant fund. We're still using them, but they're not reflected in the 2026 proposed budget.
Thank you. Through you to the administration, under adolescents care, page 185, what's the impact to the J.D. Penn's care line decreased by $88,000? What was that? Through you to the administration. That's page 185.
Through the chair, for several years now, we've been budgeting dollars there, but have had no children in that category of assistance. So we have removed it from the budget. It's weird. If a child was to enter some kind of care related to this, it would be covered under foster care appropriations.
Thank you. Through you to the administration, under daycare appropriations, page 520, the public assistance benefit increased by well over 11 million. How many additional families will this help?
Through the chair. So the 2026 proposed budget includes 7,720 funding for 7,721 children in the low income program. Currently, as of the end of September, we were serving 7,297 children in the low income program. So, like an additional 420 approximately children.
Thank you. Okay. Through you to the administration, under Youth Bureau, page 675, we saw a decrease of 44,459 in state aid. Could you tell us a little bit about that and why we lost it? Why the decrease?
the chair, we'll get back to you on that.
Great. I yield. Thank you.
Sorry, I have one more question for public health. Under 2026 major objectives, we have concluded the installation of Nalox boxes and exhausting the current supply of, can you give us just a ballpark? Doesn't have to be completely accurate, of how many naloxone boxes are in the community and how many more you think will be installed?
Through the chair, we've installed over the last 3 years, 645 Nalox boxes, both indoor and outdoor. We put them everywhere if people would accept them. It's hard to anticipate how many more we could put up. It depends on where we see trends of frequent overdoses and then finding a suitable community partner that is at a point where they've overcome the stigma to be willing to have one placed.
That's wonderful. Thank you.
Through the chair.
Thank you. And then I just want to echo what my colleague legislator Smith said about the Lollipop Farm collaboration. When I read through the budget, I think that was my favorite item. And if you want to know if I'm the kind of nerd that has a favorite budget item, yes, that's true. So, excuse me. Oh, veterans. Oh yeah, I'm sorry. Go ahead, Legislator Mill.
Moving on to Veteran Service Agency. I just have two quick questions, if I may. Through you, Madam Chair, to the administration, on page 742, why was the position of Veterans Therapy Liaison removed from the 26 budget?
Through the chair, that position was removed because we continued to evolve that program, and we took a look at it this year under the new direction of our psychologist, and he recommended that as we were evolving that program, that we remove that position.
Excellent, thank you. And just to one performance area question, again, through the chair to the administration, in the proposed 2025 budget, a major objective was contracting a female veteran peer mentor to support female veterans participating in open and nature-based therapy, but this is not specifically listed in the major accomplishments for 26. Was this achieved in 25, or is this still going to be worked on in 26?
Through the chair, it's along the same lines as we revamped that program. It was the consultation of the director of that program that component also be removed as it was offered in another capacity at the Equi Center.
Excellent. Thank you. I yield the floor.
Okay. Any other questions? Okay, next item on the agenda.
I'm sorry, I do have.
Oh, I'm sorry.
Thank you, Madam Chair. Through you to the administration, on the veterans, back to the Veterans Affair, were the FTEs at the salary adds to the existing count, or were there a shift from Westfall Road?
Through the chair, those positions are in the ARPA grant. They're not actually in the vet services budget.
Great. I yield. Thank you.
I'm sorry. Any other questions? I'm going to look a couple times now. Okay. Next item on the agenda is the approval of minutes. You have the October 27th, 2025 minutes before you. They will stand approved unless the clerk is notified of any changes by the end of the day. The next item on the agenda is new business. Madam Clerk.
Madam Chair?
Yes, Legislator Vasquez Simmons.
I'd like to make a motion to move the agenda except for items 25-0356 and 25-0364.
I second that.
Thank you. All in favor?
Aye.
Any opposed? All right, this first agenda, Madam Clerk.
Referral 25-0356, authorize a contract with the University of Rochester Pulmonary Group for the Monroe County Department of Public Health Tuberculosis Control Program.
Move it, Madam Chair.
Second.
Moved by Legislator Vasquez Simmons, seconded by Legislator Bonner. Is there any discussion? I would like to declare my interest.
So noted.
All in favor, please signify by saying aye.
Aye.
Any opposed? Item carries. Next item, please.
Referral 25-0364, authorize a contract with the University of Rochester Medical Center for medical services for Monroe Community Hospital, including specialized ventilator, pediatric, urology, and dermatology services.
Move it, Madam Chair.
Second.
Moved by legislator Vasquez Simmons, seconded by legislator Bonnet. Is there any discussion? I would like to declare my interest on that item.
Noted.
All those in favor, please signify by saying aye.
Aye.
Any opposed? Item carries. Are there any other matters to come before this committee? There being no other matters, the November 25th, 2025 meeting of the Human Services Committee stands adjourned. The next meeting of the Human Services Committee will be held on Tuesday, December 16th at 2025 at 5 p.m.
Thank you.